This episode of Q Point Podcast is pre-recorded, produced and sponsored by Karina Quirk, broker at Next Home Experience.
Different views.
I know your story.
From different cues.
Incredible job.
He's David Quirk.
You brought it up.
And she's Karina Quirk.
Imagine.
This is
Q Point.
Joining us now in studio is President of Covenant Health Foundation, Brad Coffey. Welcome to the program.
Thanks so much. Glad to be here.
Yes, thank you for coming in. We do appreciate it.
Tell us, what do you do?
I raise money and I participate in advocacy efforts for Covenant Health, which is a company based in Massachusetts that has here in the state of Maine 4 health-related organizations and a number of them outside of the state of Maine in New England and the Northeast.
What is your responsibility related to St. Joseph Hospital?
I'm the lead development person at St. Joseph Hospital, so I'm very engaged right here in Bangor.
You have an upcoming event, Commit to Community. Can you tell us about it?
Yeah, this is a super fantastic community event that is in its 8th year, and it's on September 27th on Sunday morning, happening at Broadway Park. This is an event that we're very grateful to Quirk Auto and Quirk Chevrolet for having been our presenting sponsor since the inception. It's a 10K run that's a competitive run where we'll have probably 150 or so people out there running. It's a 5K run that is a little less competitive, but a lot of fun for people like myself who might not be as competitive, and a 5K walk and a kids obstacle course.
And now all of the funds go to the SAFE program, which we've had Carrie Capaldo on here from St. Joseph Hospital, one of the leaders of that program. So if anybody wants to listen to that, it's an hour-long, 2-part series, and it's very detailed about the SAFE program. Tell us, why is it so important to support the SAFE program?
Well, I think everyone knows somebody who has been a victim of violence. I know that we talk about lots of health-related problems that impact people, and they're all important. But the trauma that someone experiences when they have been harmed by someone else, particularly someone who's been harmed sexually, is permanent. It really is deep. And our program is there for those people when they're in their period of greatest crisis. And it's there not only to help them then, but to help make sure that they get the resources they need to recover as effectively as possible. This event is the primary source of the funding for the program. It's an expensive program because it's all salaries for nurses, and they provide extraordinary care. They're highly skilled. They have many certifications in what they do, and the work they do requires a tremendous amount of training. So it's not an inexpensive proposition. And the reimbursement model for what they do is just not favorable. As a hospital here in Bangor, Maine, St. Joseph Hospital does a lot of really good things. We're a Catholic faith-based organization, and we have a huge commitment to serving people who come in who can't pay, who have an inability to bring insurance to the table. And these nurses provide that care without any consideration for whether someone has the resources to pay.
What is the goal amount?
The goal of the event is to raise $250,000. And we chose that figure because we know that that will cover the majority of the expense of the program. We don't expect to cover the entire expense. The hospital itself helps fund some of the program with profit from other parts of the hospital. We subsidize this program, but it's our goal to cover as much as we can through community support.
Yeah, we've met some of those SAFE nurses, and you're right, they are incredibly trained. And I know when Kern and I are talking to them, they take this very serious. And they do such a great job. So if you can't walk or they're not going to be over there, how else can they donate to that program?
Our event has a donation option on it, like all of these events, and someone can make a donation right through the event website. Just Google Commit to Community. It'll come right up. There's a button to make a donation, and I'd love for people to donate. As of right this very minute, we're about 90% of the way toward our goal. We have about $225,000, almost $226,000 in monies that have been raised. So we're about 24 and change shy of that goal. It's always the hardest part with these events to raise that last little bit. So if someone decides to make a gift of $10 or $15 or $20 and someone else decides to do the same thing, that's how we get to the finish line.
But you can also go over that goal if we can get a lot of donations, right?
We would love to go over that goal. Yeah, that would be wonderful.
Because you don't only service the Bangor area, they service clients throughout the state, was my understanding.
Yeah, if you look at where people come from who end up in our emergency department, they could be a resident of just about any part of Maine or beyond. It is a program that's well known throughout the state. Our nurses are regarded very highly by their peers at other hospitals. They've been advocates at the state level over many, many years now. And other hospitals often refer people to our hospital. Law enforcement throughout this region knows that this is a really strong program. So oftentimes people come up from down in Blue Hill, down East Maine, Washington County. They'll come down from Dover, Foxcroft, and beyond to Bangor because this program's here. A lot of hospitals will have one or two people who are certified in caring for people who are victims of violence or victims of sexual assault, but nobody has a program quite like ours that's 24/7 where you're going to get someone for 5 or 6 or 7 hours of time, which is really necessary, again, for someone who may have been severely traumatized by someone else.
With all the hospitals struggling to stay in business, I think this is very important to keep this program here in Bangor, Maine.
Absolutely. We know that there are programs that are shutting down in many hospitals due to financial pressures, and we're not unique. We have our own financial pressures at St. Joseph Hospital, and I know that we've all read in the newspaper about other hospitals in the region that are experiencing financial pressures. So offering programs that don't pay for themselves is a challenge, but many people in this region knew Sister Mary Noberta, who's still alive and well, by the way, so you still may know her. And she always had a commitment, she and her fellow Felician sisters, to caring for the underserved. It's right in our mission statement. So we would not be a Catholic faith-based organization if we didn't do things like that.
Yeah, I remember a story. I was at the hospital for some reason, and I was staying overnight, and she walked into the room and said, "What are you doing here?"
She was a real hands-on president, for sure. Her successor, Mary Problo, was very similar in that regard, and we're blessed to have Greg LaFrancoise, our president now, who you'll find in the cafeteria having lunch with employees or patients' family members. He's a real hands-on guy as well.
So again, go to qpointpodcast.com if you want to learn more about the SAFE program at St. Joseph Hospital. Very detailed podcast covering every inch of this program, and it's Sexual Assault Forensic Examiner is what the SAFE program stands for.
That's right.
Well, speaking of the emergency department, you have quite the project going over there at St. Joseph Hospital.
Yeah, we do. Let me say, first of all, thank you to Senator Susan Collins, who's been terrific at supporting many of the hospitals in Maine over the last several years, including St. Joe's. We've received 4, years in a row. We missed 1 year because Congress wasn't able to reach a budget. Appropriations that have helped us significantly, and this is the biggest. She was able to secure $6.8 million that's going to help improve our emergency department. We have a project that's going to cost almost $17 million. So the 6.8 is awesome, but we'll still have to raise quite a bit of money to get to the 17. And what the project is an expansion of the existing emergency department space. We have 9,000 square feet of care space currently. This will add 6,800 square feet to the hospital emergency department. Why are we doing this? That's the big question. Like many parts of this country, we're not unique. Many people are going to emergency departments for their care. Rightfully or wrongfully, that's happening in this country. And we have seen over the last several years a huge increase in the number of people doing so at St. Joe's. In just the last 4 years, we've gone from 22,000 patient encounters per year. That means people coming in and getting some level of care to over 30,000 in 2025. And we believe over the next 10 years, that's a trend that's going to continue for a number of reasons. And our space was designed for many fewer. It was designed for 14 or 15,000. We're about half as large as we should be. And we're not going to get to twice as much, but we're going to get close to that if we finish this project.
So how many emergency rooms do you have now?
We have 23, and it's a little bit of a misnomer to use the word rooms because some of these are not actually rooms. Some of them are patient care bays. But when you add it all up, we're at 23. So we have 16 treatment rooms, and then the rest are these bays. We also have a section of the hospital that's dedicated for fast tracking. If you walk into our emergency department way down the hall, you take a left, and we have patients go there for lower acuity care. So we're going to go from 23 to 31 total areas to treat patients.
So will there be an increase in physicians as well, or are you just expanding the space so that you're able to triage more?
Yeah, we don't expect that we're going to have to spend more money on more staff, to your question. We are not going to care for a lot more people because of this expansion. We're just going to treat them better in a space that is more dignified. If you come into our hospital today, you'll see on a given evening an emergency department waiting space that is packed, sometimes with people in the hallways, sometimes people lying in beds in the hallways. This will alleviate that stress.
So do you think people are going to the emergency room because they don't have their own doctor? Is that what's going on?
I think that that's a significant part of it. We've seen a real challenge trying to locate people here in Maine who are primary care providers. So there are a lot of individuals who don't have a primary care provider. They don't have somewhere else to go, and they come to the emergency department. We also have demographics that I think tend to bring more people to the emergency departments. And those are people who have doctors. But if someone has some type of a pain in the evening and they call their doctor and they can't get in to see the doctor, oftentimes they'll be told, you should go to the emergency department. And that's more common with an older population. So I think that's part of the reason why we have that as well, and that's likely to continue too.
Now, we know your goal amount. What is the time frame?
It's our hope to start the construction in the spring of next year, 2027, and have the project finished about 16 months later in 2028, probably July or August of 2028. It all depends upon the fundraising, though. We have a goal of raising at least $5 million on top of what we have currently by the end of this calendar year. And we know that that's going to be a challenge, but we'll be asking every single person in the community for support.
Okay, to clarify, you still need to secure $8.5 million for this project. You are aiming for a total commitment of $5 million by December of this year, and that would leave $3.5 million into next year and the following year. Senator Susan Collins has already secured $6.8 million, and then you had some other funds that you've already raised, and that total amount brings you to the $17 million needed for this expansion project of the emergency department. Did I get it right?
That's right.
For those that may want to get involved, how would they get involved?
Reach out to me. I'm available. I would love to have people get involved in this project. Just call our foundation office. Call us directly, 207-907-1740.
207-907-1740 to get a hold of Brad Coffey. So how will the new space be configured?
If you are on Center Street looking at St. Joe's, you would see the ambulance bays to the left. We will build a rectangular 6,800 square foot building that will be essentially perpendicular to the existing space, and it will attach to the existing space. The ambulance bays will get moved from where they are currently into the middle area of the existing ED. So as you drive in, you will park where there is now a White House that will be knocked down, and you will come into this new building, this new emergency department, and you will be greeted with a waiting room that will be almost 3 times the size of the existing waiting room. You'll have someone there actually to meet you and greet you. You won't have to walk down a hall and around a corner. The person will make it easier for you to have a private conversation as opposed to now where you sometimes might feel like your friends and neighbors are listening in. If you have a lower acuity issue, might be a sprained ankle, for instance, there will be a fast track area right off of that waiting room where you can get in quickly and get out quickly. This will reduce the amount of time that someone spends in the emergency department by quite a bit. But if you need to be treated for something that's more serious, you'll go down through the right-hand door and you'll go into a large open area where there will be a centralized nursing station where the nurses will be able to see all the rooms. It'll be much better for our staff compared to how it is now, where some of the rooms are sprinkled around areas that are not as visible to the nurses. If you have a higher acuity matter, you may go into a different area. And then finally, we will have a dedicated space in this new emergency department for behavioral patients. And while we are not a behavioral hospital and don't aspire to become a behavioral hospital, we have plenty of patients who end up at our hospital with behavioral health needs. And an emergency department is a tough place for someone who's undergoing a mental health problem. It's just a tough place for anyone. But if you have schizophrenia or if you have some type of paranoid delusions, that could be really trying for that patient. So we want to make sure those patients have a special place that's more conducive for them and for our staff to help them. So that'll be further inside the existing emergency department, away from where the more routine emergency department encounters take place. And then finally, we'll have a dedicated space for the safe nurses and for those patients coming in for that program. And they will be away from everyone else. They'll have more privacy. They'll have a space where if they're in there with a loved one, they won't feel like the world's watching them. It'll improve things for all of our patients and certainly for our staff.
Well, that sounds great. Obviously, they want privacy. They don't want people looking at them when they're coming in after such a traumatic incident. I have been a patient of your emergency department. So when you have that horseshoe, which is where the ambulances drive in, it does feel very congested. and not very safe because you're walking through there as well. So the new configuration sounds great and needed.
Yeah. The biggest improvement for the behavioral patients will be they'll have a dedicated area. Right now, we have a space that's just not up to the level probably most hospitals would aspire to. It's okay, but it's not great, and we'll improve that.
There's been a lot of controversy about H.R. 1 related to healthcare. Can you expand on what your understanding is and how it affects St. Joseph Hospital?
Sure. H.R. 1 is going to drive people off Maine care. At the end of the day, the work requirements that have been imposed elsewhere in this country often lead to people dropping their coverage. It's not that people don't want to work or we don't want them to work. It's just that more often than not, when you create obstacles to access to health insurance, people lose health insurance. So whether it's the work requirements, the renewal of your application to establish that you're truly disabled or you can't work, it's going to create more opportunity for people to come off of Medicaid. So we have estimated that at St. Joe's, somewhere between 1.5 and 3 million annually will be lost because people will no longer have their Medicaid. And at our sister hospital in Lewiston, St. Mary's, we estimate between 1.6 and 3.2 million. So as much as $6 million could be lost between these two hospitals that we operate here in Maine next year because of the changes to Medicaid brought by H.R. 1. And just to give you some perspective, someone might hear $6 million and think that's chump change. Well, whenever I do orientation at St. Joe's, I talk about how we as a hospital have had an operating margin of negative 0.6. That's negative 0.6 on average over the last 10 years. So we, as a result, cannot afford oftentimes to purchase things like new echocardiogram machines, new CT scanners. And people have to wait to get access because we can't afford to buy those things because we have a negative margin on average year over year. So when you add an additional cut or take away, I should say, revenue of somewhere between $3 and $6 million for two hospitals, it's real money. It means fewer of those pieces of vital equipment that all of us who consume healthcare need on occasion. So it's a daunting proposition. It's not tens of millions of dollars. I don't want to mislead you. Those are our best calculations. I think they're conservative. They may be higher than that. And in a year and a half, we'll be able to tell you what the exact impact is. So if I may, it's not just about the cuts to the Medicaid in terms of how it impacts those individuals. That's significant. But you also have some benefits when you participate in the Medicaid program and you have a certain number of Medicaid patients in your hospital. You're able to access a higher reimbursement rate for some of the care that you provide through your hospital-based providers if you care for a certain number of Medicaid patients. If you don't hit those thresholds, then that reimbursement rate declines. You may have heard of 340B, which is a way to help hospitals with some of the costs of providing prescription medications to patients in their hospitals. Qualifying for 340B depends upon how many Medicaid patients you have. If you shrink the percentage of Medicaid patients by 5, 6, 7, 8%, you run the risk of losing access to 340B. That has another financial impact for the hospital. So it's not just about the rate, it's about how Medicaid reimbursement fits in the whole spectrum of ways that hospitals get compensated.
In Maine, I think we have the oldest population in the 50 states, and I'm sure that's got to also drive up hospital cost.
Yeah, I will say this. Medicare is a reimbursement model, doesn't pay as well as private insurance, but they do pay their bills, and they do pay them in a timely way, generally. So we generally like Medicare, but what's changed in Maine, and I'm sure you know this, is that we've really developed a love in the state for Medicare Advantage plans. And those are attractive to people who are retiring because they require less money out of pocket for seniors. And they offer a lot of benefits. They're advertising all the time on TV, access to your health club and certain benefits for eye care and things that really don't cost a lot of money, but they're attractive to someone who's retiring. That combined with a low amount of money out of pocket, that's not Medicare. That's private insurance offered to individuals at a senior age. And a lot of Maine residents are opting for those Medicare Advantage plans, and they don't have as many benefits when you really need the high-level care as standard Medicare does. They give you fewer options in terms of what you can go to or who you can go to for care. And that can be really frustrating for you when you realize you need to see a doctor in Portland for something and they're not included in the Medicare Advantage plan.
We often hear that the hospitals that are closing, OB units are closing, are due to Maine Care not being paid at all by the state?
So I think that to maybe turn that around a little bit and get more specific, you'll hear that birthing units in Maine are closing because we have so many people on Maine Care or Medicaid. And sometimes you'll hear that hospitals' viability is threatened because so many people are on Medicaid. Many of us know of Inland Hospital, which closed last year in Waterville, for example. And we've certainly heard about the closures of birthing units for the last 10 years. That's a widespread thing happening. I think there was news of another one just this week down in Damariscotta. Thank you. So it's a complicated question. It really is. It's not a question that you can answer easily. But I can say, at least based on our experience, that the expansion of Medicaid in Maine has been financially better for us as a hospital and as a system than it would be if we had not expanded Medicaid, because many of those individuals who went on to Medicaid, if we rolled it back and shrunk it back to pre-expansion, they would have no insurance at all. And they would still come to our emergency department, and we would end up eating that cost. And that would be significant for us. And as I said earlier, if you have a certain number of enrollees in your hospital on Medicaid, there are some other financial advantages to the hospital. So if we were to shrink that Medicaid population, sure, some of those people may go on private insurance. And that certainly reimburses way better than Medicaid. That would be advantageous. But in the aggregate, the two still favor expansion of Medicaid for hospitals in terms of operations. The real reason why hospitals are closing units in Maine is a much larger challenge, and that's our demographics. We have communities in Maine where it's very hard to justify having 2 obstetricians or 2 OBGYNs. They're just not having enough babies. And it's expensive to employ 2 professional OBGYNs for a hospital when you have those small numbers of babies being born. And the malpractice insurance alone for an OBGYN is a very high cost for a business to operate, and we just don't have enough people having children. That's a whole other subject as to why we don't have that, but it's not because of Medicaid expansion.
Plus, they would need to be on call 24/7, right?
Absolutely. I really feel for the expecting mother who lives in a rural town who knows that she has to drive, or someone has to drive her a long distance to deliver a baby. And this is a huge issue for the state of Maine. And I'm not trying to make light of it, but I have heard some say that the expansion is driving these problems. And it certainly may be causing some of the problems, but it's not the primary reason.
So let me ask you this. Do you think Medicare for all would help out the hospitals that are struggling?
That's a really good question. I think that if we had a different way of providing healthcare in this country, would help hospitals. And Medicare for all should be on the table as a talking point, as a starting point perhaps. But I think at the end of the day, healthcare in this country is really expensive. And it's for a lot of reasons. And if we were to adopt a system where Medicare for all was the system, we'd have a hard time paying for it, unless we made some really big additional changes. That would be painful for a lot of constituent groups. And I think at the end of the day, as a country, it would behoove us to move in that direction, because we all know that Americans pay over now 20% of our GDP on healthcare, and we don't lead the world when it comes to health outcomes.
Yeah, I imagine there'd be a lot of lobbyist fighting going on with that.
I would imagine.
So as we wrap up, the Commit to Community event, it's what, September 27th?
It is September 27th, early in the morning at Broadway Park in Bangor.
How many people do you have signed up now?
We have 525 people who are already registered, which is way ahead of last year. And last year we had 886 people sign up to walk, run, or participate in the kids' obstacle course. We had 180 volunteers, so a little over 1,000 people participated. We are ordering our shirts for the event today, over 1,000 shirts. We really expect to have this be our biggest year.
Yeah, it'd be nice if we could hit 1,000, that's for sure.
I think if we hit 1,000, we will hit our financial goal of 250,000. They're very much tied together at this point. Every time someone registers, a portion of what they pay us pays for a shirt, and the rest goes to pay for the SAFE program.
So how much is it to register?
It's $30 for the walk-run event as of now, and I think it's $40 for the 10K. It'll go up a little bit on the day of the event.
But you can give more than that $40 if you wanted to round it up to $50.
You bet. In fact, I think most people are doing that. I signed a bunch of letters today thanking people for their gifts, and they were $10 and $15, sort of supplementing what they had signed up to pay for.
Handwritten notes? That's great.
Handwritten notes. Yeah, we love every single donor.
So once again, how can somebody get involved?
Go to Commit to Community. Just Google it. And on that site, it's filled with all the options. Probably the biggest thing we need right now, in addition to people walking and running, are volunteers. We have Bangor High School students who participate every year, Husson University students who participate every year, University of Maine students, John Baptist students, Eastern Maine Community College students. We have a lot of young people who get involved in this event, and we're really grateful to all of them.
And this is more than just Bangor, because you guys provide a lot of services outside of Bangor.
Yeah, this program provides care for people from all 16 counties in Maine, and our hospital does as well. And if you look at the event and where people are coming from who are participating in the event, they're from every county as well. In fact, we have people from 5 states in addition to Maine, so 6 total states participating in the event as of today. And as I said earlier, we're incredibly grateful to the Quirk family. They, as a group of individuals and through their business, have been champions of this cause since this event started in 2019. They are the presenting sponsor, but they also form a team. They get a lot of employees to come out and they talk it up. They promote it in their showroom, and they really embrace this cause, and we're very grateful to them.
Thank you.
President of Covenant Health Foundation, Brad Coffey. Thank you so much for joining us. It's been an absolute pleasure.
Yeah, thank you. I really enjoyed it.
Thank you very much.
Yeah, thank you.
You've been listening to Q Point.
Follow us at qpointpodcast.com or on your favorite streaming app.
This is where you can get the news from the people who make the news.
Make sure to join us next time.
We hope you tune in.
Q Point Podcast invites guests and candidates from all parties to join the conversation. The views, information, opinions, and comments expressed during this program do not necessarily represent those of the host, Q Point Podcast, associates, affiliates, and CQRE LLC.
Thanks for being a part of the conversation. The most important voices aren't always the loudest ones. They're the voices of everyday people, raising families, running businesses, serving their towns. That's who we want to hear from. Share your ideas with us online, and let's make sure those voices are never left out. Find us on Facebook or on X or at qpointpodcast.com. We look forward to hearing from you. Catch every episode at qpointpodcast.com or wherever you stream. Tune in and tell your friends.